Hi. We all know how popular artificial intelligence or AI is in our culture today. So I had an idea to test how good artificial intelligence, more specifically ChatGPT, can be when it comes to healthcare or issues related to physical therapy. So before we get started, I just want to show you exactly what ChatGPT showed me whenever I asked it whether I should take its advice or a medical professional's advice. So before we get started, watch this. As you can see, I asked ChatGPT whether or not I should believe it or a medical professional, and it was pretty clear that it can't diagnose, prescribe, or replace a medical professional's advice. Even ChatGPT knows that you should listen to your medical professionals, the ones with the human brains over the computer, of course. That being said, let's talk about what I'm going to ask ChatGPT today. So, the first part is going to be talking about hip pain. So, I actually do personally have hip pain. So, I wanted to ask it as an actual patient, but I'm also asking it first as a physical therapist. And then part two of this video, we'll be asking ChatGPT about my hip pain more as a patient though, because you'll see whenever I ask it questions as a physical therapist, I'm asking the right questions and I'm giving it the right information. But when I start giving it information and I start asking questions like a typical patient, you'll see how different the results can be. So let's get started. So I started by asking what was wrong with my hip, and it went through and asked me some simple questions, went through whether it was the front of the hip, the side of the hip, the back of the hip, red flags to look for, like not being able to put weight on it, and what I could try for now. And it asked me to describe my symptoms. So I went ahead and told it that it aches in the front of my hip, which is really common when it comes to actual hip pain. It told me about snapping hip pain that comes from the joint, hip flexor strains, and what I should do next, and some helpful tips as well, and when to get it checked, if it's going on for more than 2 to 3 weeks or if the clicking is painful. But then it asked me some more questions. So I gave it some information. So I told it I'm 40, I work out, but I also sit for work, and that crossing my legs and twisting hurts. And it proceeded to tell me it fit with the labral issue, which is true, and that there are certain things that may contribute to it, things to avoid, certain exercises. And I will make note that one of the typos did not look like English. And then what to look for, the bottom line, that it was mechanical. And then it asked for whether or not I wanted a simple 5-minute daily routine. And it did take me through some exercises: glute bridges, standing hip flexor stretch, clamshells, knee raises, hip hinge practice, which if you are a patient and you're trying to look at those things as exercises, you're not going to have a clue. So it asked me what I needed to change in my workouts. So it gave me actually some good advice: avoid deep squats, stick with some lunges, high knees, which is a little with the mountain climbers, sit-ups or straight leg raises, another, I don't know about that as a physical therapist. So it seemed a little too good to be true, and it got me to thinking. So stay tuned for part two of this video series, where I actually delve deeper as a patient and give it information like a patient. Check out the caption below to see more about seeing me for physical therapy. Thank you for the video today.